Well, this time of year is supposed to be festive, but the American Heart Association warns more people die of heart attacks during the last week of the year than any other.
Yeah, and joining us now to take a closer look at this issue is Dr. Heightened. He's a cardiologist with the University of Texas Medical Branch. And doctor, why does this trend seem to happen this time of year, and it poses such a huge risk for heart attack for so many people?
Yeah. Aaron, thank you for having me. This is a very important topic, and it's been well documented in population studies and epidemiologic studies that heart attack rates and mortality from heart attacks increase during the holidays, particularly the winter holidays, Christmas and New Year's. Now, this is related to many factors. Some of them related to overindulging in food and drink during the holiday season, particularly increasing alcohol drinking and eating salty food. Also, something related to also medication non-compliance, whereby patients miss doses of their blood pressure medications or their blood thinners during the holiday time. Also, there's lots of stress during the holiday time related sometimes to lack of sleep, travel, also stress with increase family interactions and so forth. And very importantly, many patients also sometimes miss their medical appointment before the holidays and try to defer seeking medical attention until after the holidays. Another important factor is really the under-recognition and the ignoring the symptoms of heart attacks and heart disease when they happen during Christmas time or a New Year, because they don't want a patient don't want to disturb their families with these symptoms.
Well, let's talk about these symptoms. What are some of the warning signs of a heart attack? We know that they can also be different for men and for women.
That's correct. So heart attack usually is perceived as chest discomfort. It could be chest pressure, tightness, heaviness, constriction in the chest, with associated symptoms like shortness of breath, sweating, radiation to the arm, to the jaw, to the neck, sometimes with lightheadedness, pallor, pending sense of doom, and feeling that patient is about to pass out, or even sometimes patient pass out. Now, there are differences in how men and women perceive these anginal symptoms. A woman have more atypical symptoms. They tend to have as much chest discomfort, but with it, they have also additional associated symptoms like shortness of breath, nausea, lightheadedness. And in particular, diabetic patients and older patients may not have any of those symptoms. They may have really silent heart attacks or only feeling of irritability or agitation. So depending on whether it's man or a woman and the age group and whether you have diabetes or not, you may have different symptoms of heart attack. Very important, when you're in doubt, call 911 and initiate a workup, and don't ignore the symptoms.
Dr. Heightened, thank you so much. Cardiologist with the University of Texas Medical Branch. We appreciate your time.
Thank you.